Hello, my name is Dr. Laura Cox from AccuWell Integrative Health, and today I am going to be sharing with you some research that I've done on evidence-based practices for filling the long COVID care gap. And specifically, I want to look at some integrative approaches that we can use to help manage long COVID. We're going to first do a quick introduction of who I am and what my experience is, and then we'll go straight into defining long COVID, looking at some of the various symptoms, what we know about the pathomechanisms, and then we'll go into some of the different treatment modalities and interventions that have been shown to be effective through clinical trials. After that, we're going to talk a little bit about some of the challenges that we are facing with long COVID, and we will wrap things up with a conclusion. I do want to also say that I'm going to be making all of these slides available for free to download off of my website, and I'll probably be sharing the paper that I wrote about this as well on my website. So if you would like to have more information than what is covered here, once those are up, you should be able to access those. Also, my dog might be contributing to our conversation, so if you hear her in the background, we'll just roll with it. So this is me. I am the owner and clinician at AccuWell Integrative Health, which I opened in Kenosha, Wisconsin in 2016. My career in the healthcare field goes over 20 years, and I've been practicing in this realm since, oh my gosh, like 2003, I think is when I started working in the health and wellness industry. I have a bachelor's in nutrition, a master's in Chinese medicine. I have done a 2-year advanced certification in natural functional medicine. I also have a doctorate of acupuncture and traditional Chinese medicine that is primarily focused on integrative medical specialty for treating pain and also for psychosocial phenomenon. And I am currently in a master's to PhD pathway for integrative and functional nutrition. And my primary research focus has been on treating and managing long COVID. Also, before I jump into that, I also have personal experience with long COVID and professional experience. I treat a lot of really complicated cases here in my practice, but I also have long COVID myself, and I've been dealing with it pretty much since I got my first round of vaccines in 2021. And off and on over the years, it has gotten better, it's gotten worse. And most recently, my last COVID infection was in 2023. And since then, I've had something called COVID-induced POTS, which we'll talk a little bit more about as we get into the presentation. But some of this is, all of what I'm presenting is research that I've done, but some of this I have a lot of personal experience with too. So long COVID is a really complicated situation that we're dealing with. First, there are more than 200 million people around the world who have long COVID, and it is something that is significantly underdiagnosed. One reason is because COVID is also underdiagnosed, so we don't necessarily know everyone who has had COVID. And of the people who have had COVID, whether it was diagnosed or not, we don't necessarily know everyone who has had long COVID. It's something that we're still trying to understand, and there's a lot that we don't know about it. Long COVID is going to impact anyone. It doesn't matter how healthy you are. It doesn't matter how old you are. It doesn't matter where you live, what your previous levels of health or disability, your gender, your age, your race, your socioeconomic status. Long COVID is non-discriminatory, and it can impact anyone. It is estimated that 30% of mild to moderate cases result in long COVID, and up to 70% of severe COVID infections result in long COVID. Every single time you get COVID, your risk of developing long COVID increases as well. So you may get COVID 3 times and not have long COVID, and then the 4th time you get it and you get long COVID. It has so many different symptoms. One of the problems right now is that COVID can impact and damage every single system of the body, and it does so in different ways for each individual. And so, because of that, long COVID presents as a persistent or an ongoing multisystemic disease state that arises after a COVID-19 infection. You can have one or more of the symptoms that occur immediately after your COVID infection, but for some people, it takes weeks or months before those long COVID symptoms develop, which is part of the challenge that comes with the diagnosis, because it's not always a direct line to when you get COVID and when you start experiencing your long COVID symptoms. And multiple systems are going to potentially be impacted. Sorry, my dog wants to join us. Which means that there are hundreds of possible symptoms. Currently, we have at least 200 documented symptoms that we know of, and there are significantly more that have just not been scientifically documented. And right now, we have no idea how long COVID lasts. Some people start to feel better after a few months. Some people have been dealing with this since the onset of the COVID pandemic in the end of 2019, beginning of 2020. So hundreds of symptoms have been documented, but some of the most common symptoms are listed here on this page. One of the things that I'm seeing the most significantly is this persistent fatigue and brain fog, so difficulty concentrating, memory changes, also some dizziness and lightheadedness, increased heart rate, a lot of depression, anxiety, tinnitus, ringing in the ears. One thing I don't think I listed here that I'm seeing a lot too is an increased production of mucus. So you get a lot of postnasal drip, or you get this like feeling like you have a plug in your throat, like a lump that you just can't get rid of. And a lot of people are experiencing those changes in your sense of smell or taste. Doesn't necessarily mean that it goes away, but it could be that some things just smell or taste different. Some people have no smell or taste. So it really depends. I'm not going to read every single one of these things to you because that would take forever, but just know that just because somebody is not experiencing the exact same manifestation of long COVID doesn't mean that they're necessarily dealing with something different. It can manifest in countless ways. Unfortunately, that list of symptoms is far from comprehensive, and it can lead to not only other symptoms, but also systemic conditions as well. Long COVID and COVID itself has an impact on your digestive microbiome. And so there's going to be a significantly reduced bacterial diversity. And we also see lower concentrations of the short chain fatty acids that are produced by the healthy gut bacteria compared to those who have not developed COVID or who haven't developed long COVID. And these disruptions in the gut microbiome can have a systemic impact, and that can impact your immune system regulation, metabolic health, your emotional and your neurological health. It can make you more susceptible to infection. It can decrease your nutritional absorption. It can make it harder for you to recover or for rehabilitation, and so many other things that can come from a disrupted microbiome. Also, 76.7% of people who develop long COVID also develop something called dysautonomias. So this is a syndrome or a condition that's going to impact your autonomic nervous system, like POTS, postural orthostatic tachycardia syndrome. That's the way that mine currently manifests. And dysautonomia is basically those automatic functions that our body takes care of on its own. There's a breakdown in the communication between our nervous system and the systems that they're supposed to regulate. And so that breakdown in communication can lead to things like dizziness, increased heart rate, palpitations, loss of consciousness, and nausea, a lot of other things as well. One of the super fun ways that my POTS manifests is that if I exert myself too aggressively or too assertively, then my autonomic nervous system tries to regulate itself by triggering a gag reflex. And there are ways that you can stimulate your autonomic nervous system: gagging, coughing, and bearing down, like you're kind of those are things that will stimulate your autonomic nervous system. And so the body will sometimes kick in and do that automatically when it feels like that system is being threatened by overexertion. And then that overexertion leads to post-exertional malaise, which is basically a deep sense of exhaustion and brain fog that can last for days or weeks after you have that kind of exertion. These dysautonomia symptoms can last on average for about 36 months. However, it can continue easily beyond that point. And there is POTS before, or there was POTS before there was COVID, which can be triggered by other viral infections, and that we don't see a ton of resolution. So there are some concerns that COVID-induced dysautonomic conditions like POTS might never fully resolve. So the way that I am treating those patients and myself is like, we're going to be learning how to manage this condition instead of looking for ways to cure it, because as things currently stand, we don't know of any cures for these conditions. Some other commonly diagnosed conditions include interstitial lung disease, chronic kidney disease, cardiovascular disease, type 2 diabetes, changes in your lipid levels. So that's your triglycerides and things like that. We have chronic fatigue syndrome, fibromyalgia, mast cell activation syndrome, and other autoimmune conditions or autoimmune-like conditions. And one thing that I see with a lot of people too, they may not necessarily develop diabetes, but we do see other dysregulations or disruptions in metabolic function. And you can get long COVID from either the COVID infection or from getting the vaccine for some people. And I saw a lot of people who got the COVID vaccine or who got a COVID infection who then gained a significant amount of weight and had a really hard time losing it. I myself gained 40 pounds within 4 months after getting my second dose of the vaccine, and it took a really long time for me to be able to lose that weight again. The pathophysiology, or the way that the pathogen develops, is still unknown, but there are some mechanisms that are hypothesized. And it could be one, it could be a combination of these, or it could be none of these. It could be all of them. We still don't know why some people develop long COVID. However, they do suspect that there's, for some people, a reservoir of COVID kind of tucked away. Just like with other viral infections, it doesn't necessarily fully resolve, it just kind of goes dormant. It could be an inflammatory response, such as the cytokine storm that happens after you get that initial infection. Endothelial dysfunction is basically the clotting issues and things like that, some autoimmune or autoimmune-like responses in the body, and chronic inflammation with that as well, and the disruption of the digestive microbiome. But again, we still don't exactly know why long COVID develops. And there is no scientific agreement on a diagnostic mechanism. There's no lab tests, there's no diagnostic biomarkers, there's no validated medical treatments. We don't have a whole lot of answers. And part of the problem that comes from that is that our medical practitioners don't know how to diagnose long COVID. So what we are seeing with integrative treatment approaches is that it is most effective to treat long COVID on an individualized, integrative, and multimodal approach. What that means is that each patient that presents, we're going to treat you and your individual symptoms. It's going to be an integrative approach, so we're going to use different treatment approaches from both conventional medicine and from more holistic approaches and natural methods, and multimodal, meaning we want to combine different approaches. So there is no one size fits all approach to treatment. There's no one size fits all approach to diagnosis either. And we're seeing a combination of medications, nutritional supplements, lifestyle adjustments, and then there are also some clinical treatments that have been shown to be beneficial as well. There are a lot of things that people are experiencing benefit from and relief from that don't have any kind of clinical research trials done yet. So I didn't include that in this presentation, but just because I'm not talking about it here specifically doesn't mean that these are the only things that people are getting benefit from. And I do want to just say that there is something to be said for anecdotal evidence. So the stuff that we're seeing from people who are, there are hundreds of thousands of people in these long COVID groups on Facebook and things like that who are experiencing relief from treatment approaches and supplements that don't necessarily have the research behind it yet, because the pace of research, unfortunately, is very slow. Out of necessity, we want to make sure that we're doing things right. But there are things that I'm not going to talk about here that I might integrate into an approach with one of my patients or with myself. So just keep that in mind as we move forward. Okay, now she wants to get down. Okay, so we're going to look at three different categories. We're going to look at clinical treatments. So that's going to be your in-office or your telehealth treatments. And those are services that are facilitated by a licensed practitioner or somebody who has clinical credentials. We want to look at pharmacological interventions, so prescriptions that have been approved for other conditions that are being utilized off-label to treat the long COVID symptoms, and nutritional applications. So we're going to look at some dietary and lifestyle adjustments and some nutritional supplements that can help support some of the manifestations of long COVID. First, the evidence-based clinical interventions that we are seeing. Acupuncture, cognitive behavioral therapy, aromatherapy, mindfulness practices, and more have been shown to be really beneficial. There's also some benefit to light therapy and bath soaks as well. These are the things that we're seeing clinical studies on. And what I use in my practice specifically is the acupuncture, mindfulness practices, and the aromatherapy. If somebody needs cognitive behavioral therapy, then that's something that I can send them to. There are the other things I do too, but just from this list, that's what I work on. I also have some bath soaks and some light therapy devices that I utilize in my practice. There are studies on exercise therapy, like physical therapy, and for some people, it's really beneficial. For other people, it makes things worse. That's really going to depend on whether or not the long COVID patient has that post-exertional malaise. If that is the case, then exercise is going to make things worse. If patients don't have that post-exertional malaise, then there are some improvements that can come from physical therapy exercises. And also specifically saw some physical therapy around opening up the diaphragm to help with breathing treatments that seemed to be really effective as well. Tragus nerve stimulation is the nerve that helps to regulate your autonomic nervous system. And then this high definition transcranial direct current stimulation is something that is currently used in depression, like severe depression treatments. So some trials are showing that those are providing relief for POTS symptoms as well as anxiety and fatigue. We're seeing oxygen ozone therapy and hyperbaric oxygen therapies, which both have been shown to improve symptoms like that fatigue, pain, and things like that, brain fog. And then the telemedicine has been a really beneficial approach, especially for the long COVID patients who are bedridden or are unable to leave their home or drive. And specifically, the trial that I saw was looking at teaching symptom management strategies, self-advocacy techniques, so how to talk to your doctor about long COVID and how to get the care that you need and how to communicate with your healthcare team. Those seem to be the most effective methods in treating through telemedicine, along with cognitive behavioral therapy. So pharmacological interventions or prescription medications, currently there's nothing approved by the FDA for long COVID. And so doctors are resorting to using either preventative measures or using other medications that have approval for different uses being applied with off-label uses while clinical trials are being implemented. Prevention of getting a COVID infection might be the most effective way to avoid getting long COVID. So one of the recommendations is staying up to date on your vaccine schedules. If you are not someone who has a reaction to the vaccine schedules, I've always been sensitive to vaccines, so it's not a good match for somebody like me. And there's no one size fits all when it comes to vaccination schedules either. So that's something that you and your medical doctor will need to have a conversation around to decide whether or not it's the appropriate approach for you. However, the vaccines have been shown overall to be more beneficial than doing more good than harm for the majority of people. That doesn't diminish or discount those who have experienced vaccine injury. So I don't want to discount that. But for most people, staying up to date on your COVID vaccine is going to be really beneficial at reducing the risk of developing long COVID for most, even if you do get COVID. And some people who have developed long COVID experience a reduction or a complete resolution of their symptoms after getting a vaccine. So if you get COVID, you develop long COVID, and then you get a vaccine, some people are seeing almost like a spontaneous improvement after that. However, other people are experiencing no change or they're experiencing an increase in their symptoms after they get a vaccine. So again, this is going to be a very individualized approach. Medications like metformin or the GLP-1 medications like semaglutide, tirzepatide, liraglutide, those may reduce the risk of developing long COVID if they are taken early enough in the post-infection state. So metformin specifically has antiviral properties. There are studies that showed people who were on GLP-1 medications when they got COVID were less likely to develop long COVID. So that's something to keep in the back of your mind. They are not currently being I was not able to find any current studies saying that they reduce long COVID. However, I have seen people go on these GLP-1s and experience a reduction in their long COVID symptoms. I started using semaglutide myself to help manage my palpitations and some of the other long COVID symptoms. And basically it helps with the metabolic dysregulation that long COVID can trigger. So it was helpful for me. I've seen it helpful for other people as well, but again, not a one size fits all. Sometimes using antiviral medications after you get COVID can also reduce the risk of developing long COVID. So if you get a COVID infection, call your medical doctor as soon as you can so that you can get those antiviral medications sooner rather than later. And that might help to reduce the risk of developing long COVID. Also, before I go on, keeping your immune system healthy is something else that you can do as well. And we'll talk a little bit more about that when we get into the nutritional aspect. There are some studies showing that SSRIs, or selective serotonin reuptake inhibitors, can help to reduce brain fog, sensory overload, chronic fatigue, and those dysautonomia symptoms. So that's going to be things like antidepressant medications can help with that. Not for everyone, but again, there have been some beneficial studies. Modafinil, which is a medication, I don't know if I said that correctly, but it's typically used for treating narcolepsy. They're seeing some success with the neurocognitive issues like brain fog and some of the sleep disturbances that are associated with long COVID. And there was a combination of the fexofenadine and famotidine, I think is how you say that, to address the mast cell activation. And that also was showing some benefit in improved fatigue, brain fog, heart rate, and digestive disruptions. Low-dose naltrexone is the medication that I have seen the most research around, and it's been linked to a reduction in pain, improvement in the chronic fatigue and the post-exertional malaise, and improved quality of sleep. And I can say from personal experience that low-dose naltrexone has personally been very, very beneficial and was a game changer for my post-exertional malaise. However, nutritional interventions are going to, did I skip this slide? No, I didn't. Okay. Nutritional interventions are going to be one of the most effective and the safest approaches for that first frontline treatment of treating long COVID. Even before the pandemic, Americans were largely deficient in the micronutrients that specifically support our inflammatory and immune systems. And there is a direct link between micronutrient deficiency and a risk of long COVID. So this is where nutrition is going to really come into play and be a critical component of managing and treating and potentially even preventing long COVID. Dietary intake can be one of the best therapeutic interventions that you can take. So a lot of studies that I saw across the board were talking about the Mediterranean diet. Or you can also look at like blue zone diets. These are going to be diets that are really heavily focused on eating a broad variety of vegetables. You want to have lean proteins and healthy fats like coconut oil, olive oil, organic butter, things like that. Those participants who were able to adhere to a Mediterranean style diet were more likely to experience a reduction in the cardiometabolic risk factors that are associated with long COVID. So that improved their waist circumference, their body mass index, their triglycerides, their LDL, their total cholesterol. We saw improvements, or the researchers saw improvement in blood pressure, in blood sugar. The good healthy fats were improved in, we also saw improvement in uric acid levels. The Mediterranean diet is also just one of the diets that's been the most researched to show general benefit across the board. So if you don't have long COVID and you're just like scratching your head as to like what's the best dietary approach to take, Safe bet is going to be the Mediterranean diet or some version of it. There was a randomized control trial that demonstrated using vitamin D3 combined with K2 reduced the severity of long COVID symptoms and improved gut and inflammatory biomarkers. This is something that I personally really have benefited from as well. Using vitamin C has, especially intravenous vitamin C for treating the fatigue and inflammation associated with long COVID, has some promising potential. This is a treatment that has been utilized for some cancer patients, and they started trying it for long COVID. We don't have a ton of data on it, but the data that was available did show some benefit. And then there was also another trial that looked at liposomal vitamin C with L-arginine for 28 days, and that improved walking stamina, muscular strength, endothelial function, and reduced fatigue for long COVID patients. There is, again, a direct link between the health of the microbiome and the longevity and severity of your long COVID symptoms. So gut health is going to be super important for long COVID. And there was a randomized double-blind placebo-controlled trial, which is kind of like the gold standard of research, that utilized a formula with probiotics and prebiotics and some other enzymes, and they used that for 6 months, and at the end of the trial, the group that took that probiotic combination had improved concentration and memory. Their fatigue was better. They had less gastrointestinal upset, and overall, their general well-being was improved. There was another, I really love this picture, by the way, just as an aside. There was another comprehensive study that looked at supplements with different multivitamins, including A, B complex, C, and D, that was promising. And the challenge with that, there were some potential inconsistencies across the different studies examined. So some studies had different levels of dosing, or there were different combinations. So it's hard to make any conclusive results when there was so much discrepancies across the different types of studies. But looking at all of these different studies that were done on these multivitamins did show promising results. So a review basically is when somebody sits down and gathers all of the studies that they were able to find, and then they go through the results of all, they compile the results, kind of like what I'm doing here. There was a preliminary study on a creatine glucose compound that also did show some potential improvements in symptoms. And another study looked at nutritional interventions for sarcopenia in long COVID, and a combination of vitamins and minerals. That's A, B complex, C, D, E, and K, and the minerals potassium, calcium, magnesium, manganese, molybdenum, I can never say that one, selenium, and chromium, iodine, iron, zinc, and copper, paired with some essential amino acids and dietary balance of protein, fat, and carbohydrates, improved significantly muscle strength, body composition, and functional parameters. So all of the different functions of that are impacted by long COVID, specifically the sarcopenia. Another study looked at the feasibility of using omega-3 supplements to help reduce long COVID symptoms. It was 12 weeks, and we did see a reduction in inflammatory markers, but there was no statistically significant change in symptoms. That doesn't mean that omega-3s aren't going to be beneficial, because supporting the inflammatory response is going to help across the board with long COVID. However, further research is going to need to be done to find out if this is specifically beneficial to the long COVID manifestations. There were significant studies that looked at different Chinese herbal medical treatments or some combined plant extracts that did show some potential in improving sleep, anxiety, fatigue, post-exertional malaise, and overall severity of symptoms. So there are a lot of encouraging preliminary study results. But there's currently no validated methodologies or modalities. There's no medical consensus, and there's no established standard of care for diagnosing, preventing, or treatment or managing long COVID. So that's a big challenge that we're facing right now. The peer-reviewed studies that we have are limited, and they primarily focus on symptom management instead of prevention or cure, partly because there are so many different ways that long COVID can present itself, and also because this is still relatively new. I know we've been dealing with it for the last 5 years as of the time of recording, but in the research world, that's like a blip. There are still plenty of studies being done, but most of the studies are either preliminary studies or pilot studies, and they use small groups to test the feasibility of an intervention to see if it is even worth exploring an idea further. So a lot of the results that we're seeing were really beneficial for small groups of people, but it's hard to know if that is going to be generalizable, so if it can be applied to a larger population. For practitioners, there's a lot of diagnostic uncertainty and there's a lack of clinical guidelines. And so clinicians and practitioners are really kind of forced to take this trial and error approach to treating long COVID. Another challenge is that because there's no clear diagnostic biomarkers, long COVID is diagnosis of exclusion, meaning if you don't fit into the parameters of other diseases, then they will kind of settle on long COVID. Fibromyalgia used to be like this, actually, back when I started back in 2003. Fibromyalgia was something that they knew was a thing, but they didn't really understand it. And so if you didn't fit into other medical categories, then they would settle on fibromyalgia. But now research has and science has progressed enough to the point where we know that there are diagnostic biomarkers and indications that warrant a diagnosis for fibromyalgia. So I'm sure eventually we will have that for long COVID. However, right now we don't have that. So doctors are kind of like at a loss when it comes to whether or not long COVID is the appropriate diagnosis. And there was a survey done of primary care physicians, and in that survey, 81% were not comfortable treating long COVID, and 70% didn't know when they should be referring their long COVID patients to a secondary source, like an expert or a specialized clinic. And an overwhelming majority, almost 100%, it was 93% of those primary care physicians acknowledged that they had gaps in their education and training around long COVID. I've heard a lot of people say that their doctors don't even acknowledge that long COVID is a legitimate diagnosis at this point, which is unfortunate. For patients, navigating the healthcare system is really challenging. Finding practitioners who are willing to believe their experience, finding practitioners who know how to treat their symptoms. A lot of the treatment options that are being tried right now are either anecdotal evidence, like word of mouth experience, or off-label applications for medications, or they're services that are outside of the conventional medical system. And so because of that, health insurance doesn't cover a lot of the treatment that these patients need, which means that those expenses are coming out of pocket. And the treatments that are available are still really limited. So they have limited option, they have limited coverage, if any, and they have limited access to practitioners who believe them or know how to treat them. Many of these long COVID patients find that they have unmet expectations when it comes to their healthcare practitioners. And a lot of times there are reports of them being gaslit and dismissed when they are seeking care. if you ever experience a doctor who is unwilling to acknowledge that your symptoms are actually happening just because you don't have a diagnostic lab test or something like that to quote unquote prove it, then that's your sign to go find a new practitioner. 79% of patients, long COVID patients that were surveyed, reported having negative interactions with their medical practitioners, including having a really long journey to diagnosis, their symptoms being dismissed or disbelieved, and a lack of treatment options offered. And patients report living with fear and uncertainty. It's scary not knowing if you're ever going to get better. And there are people who went from literally running marathons to being unable to get out of bed because their long COVID is so severe. It is a arduous and often impossible task to find practitioners who have adequate knowledge of long COVID. And another unfortunate reality is that our medical doctors and nurses are really overburdened. The pandemic put a large strain on our practitioners, and a lot of them quit. And so the practitioners that we do have, many of them don't have time or resources to even, or the energy or the capacity to even learn more about it. So it's difficult all around. So, conclusions. Long COVID is a widespread medical concern, and it does deserve rigorous attention. The complexity of symptoms, the comorbidities or the other diseases that come along with it, and the confounding factors combined with vast misinformation, a vast lack of knowledge about long COVID. All of this is a challenge to the researchers, the practitioners, the patients, and the public alike. There is a lack of agreement on what long COVID should even be called, and how it should be defined is constantly changing and evolving. Practitioners, by no fault of their own, are lacking knowledge and training and resources to treat their patients. Patients often understand that their practitioners face these limitations and challenges. However, they are desperate for answers. They're desperate for support, for guidance, and for acknowledgement. Even if a practitioner doesn't necessarily have the answers that those patients are seeking, like, it's better to hear, "I don't know, but I believe you," than it is to say, "It's all in your head," or "You aren't experiencing these things." However, there is progress. So we currently have 566 clinical trials listed by the National Library of Medicine. So if you go to clinicaltrials.gov, you can type in long COVID, and that'll show you all of the clinical trials that are currently either ongoing or in the recruitment phase. And of those, 357 are interventional studies. So that means 357 of those studies are exploring options for clinical treatments, for supplementation, for educational interventions, for dietary approaches, and for medical medications like pharmacological interventions. So don't give up hope. We have promising results in the nutritional, clinical, and pharmacological interventions. And if this is something that would be helpful, take a screenshot of this. You can take this to your doctor and show them that these are the interventions that research has clinically proven or has clinically demonstrated to be beneficial. Nutritional approaches are going to be the safest and easiest approach to treating and managing long COVID. With little to no risk for most people, you can take a pre and probiotic to help support your digestive microbiome, comprehensive multivitamins and minerals, especially, I didn't mention this specifically, but taking an electrolyte drink or some kind of electrolyte supplement every day can be really beneficial for this patient population. consuming a high fiber diet, so a minimum of 28 grams of fiber per day, on average, should be a good target for people, and that's going to help to feed the microbiome and continue to improve your digestive health, while also making sure that you have a good balance of dietary protein, fat, and carbohydrates. Specifically, look into the Mediterranean diet if you need a little bit more guidance, or you can work with a clinician like me. Nutrition is a really huge part of how I practice. Clinical treatments and self-care modalities that are helping patients feel better: acupuncture, aromatherapy, mindfulness, cognitive behavioral therapy, the light therapy, and mineral baths. These are some effective supports available for long COVID patients. Telemedicine is great for patients who are unable to travel to their practitioners, and exercise therapy can be beneficial for patients who don't have post-exertional malaise. Pharmacological interventions, again, these are medications that have a proven track record to help manage inflammation, a histamine response, viral infections, narcolepsy, depression, and diabetes. These are successfully being repurposed to reduce pain, fatigue, brain fog, post-exertional malaise, and other associated symptoms. And antivirals, COVID vaccines, and some diabetes medications are acting as preventatives. So potentially reducing the occurrence of new cases of long COVID developing is just as important as treating those who have it. The good news is that there is hope for us. There is hope for long COVID patients. And while we do still have those gaps in our knowledge, the accessible clinical treatments, pharmacological interventions, and nutritional supports, we're still missing pieces. There's a growing body of research and evidence for different treatments and interventions that can be taken for long COVID. And there's also a growing community of long COVID patients, practitioners, and researchers who are coming together, who are learning from each other, who are offering each other support, sharing their successes, sharing the experiences with each other. And I know I will always be somebody that is continuing the search for more answers, along with many other patients and practitioners. So if you are somebody with long COVID, or you know somebody who has long COVID, I know that it is frustrating and I know that it's scary, but don't give up hope. Thank you very much. There are a million references I have. If I am somebody that you are interested in working with, I do now have telehealth appointments available. You can schedule a free call with me on my website to see if you're a good fit for my practice. And then I've got, again, a million pages of references. I'm not gonna really pause on these, but if you want to see them, oh, there we go. If you want to see them, these are all going to be available soon on my website. So you can go through all of, I think I had 14 pages of references. There we go. So you can go through all of that once I have that available for download. And again, if you are somebody with long COVID, or if you are a practitioner who is studying long COVID, we have answers on the way. Don't give up hope. And thank you very much for your listening. And until next time, I invite you to live well, choose well, and be well naturally. Bye.